We're very fortunate because dental implants have gone through many evolutions and improvements for their success rate to be in excess of 95, 96% at 20 and sometimes 30 years. So we're very fortunate to have that option for patients. However, in certain situations, implants may not be successful. It can be related to a medication the patient's taking, neglect, they're just not cleaning them properly. If a person's starting to notice signs or symptoms of failure, which typically would be pain, the implant itself feels loose, they may notice some swelling, a bad taste, I would encourage them to contact the dentist that placed the implant, or feel free to contact us for a second opinion or an evaluation at no charge, so we can at least try to figure out what's going on. It may be something simple, or it may be something that is becoming more serious and we need to be treated immediately. When people are looking at replacing teeth and they're considering it, it's very predictable and successful to replace a single tooth or 2 to 3 teeth with implants. It's a fairly straightforward procedure, and many of our patients tell us that replacing a tooth is easier than having a tooth removed. It's shorter, the healing time is quicker, and then there's less discomfort. I tell all my patients, if an implant fails in the first 3 years, I replace that implant for them free, no charge. That's how I stand behind what we do at CREIOSC. So if you have any concerns, any questions, you want to get more information about dental implants, feel free to call us at Coulee Region Implant Neurosurgery Center or CREIOSC for a free consultation.